Hey everyone, welcome to our channel. I'm Wefafa Andrew and today we are going to talk about diabetes mellitus, commonly known as sugar or sukari in Uganda. So before we talk about it, viewer, I request you to do me a favor and you consider subscribing to our channel by clicking that red subscription button, like and share this video. Now, diabetes mellitus is a disease which results in high blood sugar. So what happens in normal circumstances? When you are eating food, the bigger particles of food are broken down in the mouth with the help of teeth. Now, that food is swallowed, which passes the esophagus down to the stomach. In the stomach, food is also broken down further into smaller particles by the help of the movement of the stomach. Also, there are some enzymes which break down some food. And then that food, from that point, it goes to the small intestines. It is in the small intestines where food is now absorbed into our blood in form of blood sugar. Now, when the food reaches our blood in form of smaller particles called glucose, that food or that glucose has to enter our body cells for us to be able to use that glucose. Now, just like you may go somewhere and you find a place is locked, you need a key to enter that place. That happens with our body cells also. Our glucose, when it reaches our bloodstream, for it to enter our body cells, it needs an enzyme called insulin. In diabetes mellitus, the body may either not produce that insulin, or the body may develop resistance to the insulin which is being produced. And insulin is produced by the organ which is just near our liver and the stomach. The organ is called the pancreas. Now let's look at the types of diabetes. We have majorly two types of diabetes. Type 1, also referred to as insulin-dependent diabetes, and type 2, which was formerly referred to as non-insulin dependent diabetes. There are also other forms of diabetes like gestational diabetes, which is usually common in pregnancy, and when someone gives birth, that type usually goes away or someone recovers. Now, what causes diabetes? The cause depends on the type of diabetes. With type 1 diabetes, there is autoimmune destruction of the cells which produce insulin in the pancreas. Remember, we said that diabetes, the cause may either be when the body is not producing insulin, or the body is producing insulin but it finds resistance. So in type 1, the body does not totally produce insulin. So what causes it? I mentioned that there is autoimmune destruction of the cells which produce insulin, the cells of the pancreas. So what does autoimmune mean? Autoimmune simply means when the body overreacts, or when the body by mistake recruits or forms antibodies against its own body organs or cells. Now with type 2 diabetes, the body produces insulin. It may be little, but even with the little which is produced, there is resistance to it, what they call peripheral resistance to the cells. Cells like cells of the liver, cells of our muscles, and others. Now, let's go ahead to look at the risk factors, or what puts you at the risk of developing diabetes mellitus. For type 1, it is majorly when someone has a genetic predisposition, and also when someone has an infection majorly the viral infection like the mumps virus. When you get infection with mumps, you are at the risk of developing type 1 diabetes, because as the body reacts to the virus or the infection, it may overreact and it ends up reacting to your pancreas, also ends up destroying the cells which produce insulin. With type 2, the risk factors for resistance include things like someone who is obese, or someone who is like big in size than the usual size or the normal size, and then also someone who is inactive, someone who does not do exercises, and then someone who smokes. So those are the risk factors. Now let's go ahead to look at the clinical features of diabetes mellitus. Now someone majorly in type 2 may not present with any sign, and you may just find out that someone has diabetes when they go for screening. Now, what are some of the commonest signs of diabetes mellitus? We have some 3 major signs which are called the 3 P's. These include polyphagia, when someone eats frequently, and then we have another sign called polydipsia, when there is excessive thirst, and then we have another sign called polyuria, which is excessive urination or urinating frequently. But there are also other non-specific signs like feeling tiredness, generalized body itching, and then blurred vision. So let's go ahead to look at the investigations of diabetes mellitus. Available investigations include fasting blood sugar, where we use a machine called a glucometer to test or to check for your blood sugar when you fasted at least 8 hours minus eating food. Then we also have what they call the random blood sugar, where we check your blood sugar at any time without whether you're from eating or not. And then we also have another investigation called urinalysis, where we check your urine for things like ketones and then sugar. So how do you diagnose someone with diabetes mellitus? If someone has the signs I mentioned above, plus the fasting blood sugar of greater than 7 millimoles, someone is diagnosed to be with diabetes mellitus. Or if someone has the signs I mentioned above with a random blood sugar of 11.1 millimoles per deciliter, someone is diagnosed to be with diabetes mellitus. We can also do the oral glucose tolerance test, where you take 75 grams of glucose, and then after 2 hours they test your blood sugar, or they check your blood sugar. So if you have the blood sugar of greater than 11.1 millimoles after taking 75 grams of anhydrous glucose, then you are diagnosed to be with diabetes mellitus. So let's go ahead to look at the complications of diabetes mellitus. If not well managed, it may result into several complications. Now, diabetes can affect many organs in our body. Someone may end up with the effect on the kidneys, which is called diabetic nephropathy, or someone may get a problem with the eyes, which is called diabetic retinopathy, where you will not even be able to see very well, or you will end up getting blurry vision. And then someone can also end up with the effect on our body nerves, which is called diabetic neuropathy, where you feel signs like tingling sensation of pains, and those other things. You may also end up with the problems with the heart, where someone develops what they call myocardial infarction or a heart attack. When it has affected your heart, you may also end up with a stroke when it affects the blood vessels supplying your brain. You may also end up with impotence. You may end up also with diabetic foot, where you have some chronic wounds majorly on your legs which don't heal easily. There are also other acute complications which include coma, or where someone loses consciousness. This may be due to a very low blood sugar, maybe when you're using insulin and you take a higher dose, and that is called hyperglycemia. Or someone may present with a very high blood sugar. How do we manage diabetes mellitus? Now, for type 1, we use insulin, while type 2, we start with lifestyle modification. Like if you are inactive, we tell you to do some regular exercises with the aim of reducing the body weight, because obesity is a risk factor for someone developing diabetes type 2. And when you do that, when most people reduce their body size, usually their diabetes type 2 improves. And then another thing, if you are smoking or taking alcohol, we advise you to stop, and that also helps very much. Another issue is when you have other conditions like high blood pressure, dyslipidemia, we tell you or we encourage you to manage them. And when you do those things, your blood sugar also improves. Another issue is about your diet. We usually advise our clients to work on their diet, to eat things which will not make them grow very fat, and then that also helps to control their blood sugar. When the above things fail in type 2, we initiate you on oral drugs, the drugs for swallowing, which help your body to take in blood sugar. When those ones fail, when the drugs fail, we usually combine them with insulin for better results. But I'm going to make another video on the diabetic diet, because it is a very interesting topic. I will capture even the general advice for the diabetic patient, and also I'm looking forward to making a video which shows how you can check your blood sugar and how you can interpret them from your home. So if you found this video important, I kindly request you to consider subscribing by clicking that red subscription button, like and share the video. And also let me know in the comment section what you've learned from this video and what you'd like to add or subscribe. Thank you very much. God bless you.